data infrastructure.
Speaker today is Gary Saunders, and Gary is the Human Data Coordinator at ELIXIR, where he leads the implementation of the ELIXIR-wide strategy to enable responsible sharing of human data consented for reuse in scientific research. So Gary, I'll hand over to you now.
Okay, good morning. I hope that you can currently see my screen. Please shout that's not the case. Yeah. So I also have some questions for Nathan. I thought that was a fantastic presentation, and it leads into what I'll speak about incredibly well. So the focus that I'll give on federated access to sensitive human data is that from the infrastructure. So how do we build a technology independent infrastructure? So Nathan set the scene incredibly well that, you know, across Europe, across the globe, many different technologies are used. Maybe I'll take a step deeper to what we're doing at ELIXIR, which is an e-infrastructure for European data. Maybe I'll take a step deeper into say, how are we building that infrastructure? How are we coordinating that infrastructure that allows this free access to sensitive genomics data across international borders? So right now we know that human genomics data is going through a step change. It's relatively quick and simple to generate genomics data. And the potential is there to build cohorts that are in the millions, virtual cohorts that are in the millions of human samples. And this is what is needed to really understand the mechanisms of disease. When we think about mechanisms of disease at the biology level, we're often looking at statistical significances, statistical significance markers, statistical significance on disease mechanisms and disease pathways. And really to get statistical significance, we need huge sample sizes for the data sets that we're working on. So the need is there. The need is there to access these data. And in these figures on the right-hand side, what I'm showing is that the data generation is shifting to the healthcare system. So it's predicted that by 2022, as much as 80% of human genomes and exomes will be funded by the healthcare systems across the globe. Now, we can see the manifestation of these numbers in this figure at the bottom here. So this is a map of national genomics initiatives across Europe. And we can see that nearly every country there has its own national genomics initiative. So this brings the challenges if we want to try and access these data across international borders. So let's look at what those challenges are from my perspective, from the infrastructure perspective. So again, most sequencing of the future will be for healthcare and not for research, but the potential is there to build a virtual cohort of as much as 60 million human samples by 2025. The key challenges that I'll address in this presentation and provide a framework for are that the data is geographically distributed. Healthcare data, as was explained in the previous presentation, is a national competence and is often not able to leave those jurisdictions. And the high volumes of data that are generated mean that even if we are able to transfer these large files around, this tests the limits of centralized models. We can't be submitting petabytes and exabytes of data around the place easily. We don't have the resource and we don't have the infrastructure at national or international scale. Additionally to this, clinical data across Europe, across the globe, are of variable quality, are on the whole not interoperable. And healthcare data is not used to handling this amount of genomic sequencing data when we're talking about terabytes or exabyte. The technical know-how of how to handle these data resides within the research setting. So we have to try and build capacity within the healthcare setting to handle these data. But underpinning all of this is trust in a data access and data governance model. Now, many of you will know that in spite of these huge challenges, there is a political will to address these challenges across Europe. There's a declaration now signed by 23 EU states and EEA members that has declared the access to 1 million human genomes by 2022. Now, at the moment, the 9th signatories meeting is ongoing. Many of you at this meeting will have representatives at that meeting. But a declaration in the previous months has set out a roadmap of how it can achieve the aims of that declaration to access 1 million human genomes transnationally by 2022. And at a high level, in 2020, it's about engagement and building the governance. 2021, translating the governance and the requirements into standards and guidelines. And then in 2022, driving the uptake of those standards, those guidelines, and those proof of concepts to meet the aim of the 1 million genomes declaration. Now, a project that you might be aware of or might not be aware of that I'll spend a couple of minutes explaining is something that I'm involved in, which is called the Beyond 1 Million Genomes Project. So this is a coordination and support action from the Commission that is implementing the roadmap of the 1+ million genomes roadmap. Pardon me, it's implementing the 1+ million genomes roadmap. So again, it runs across the same 3 years. And if we look at the roadmap for the B1MG, 2020 is about engaging and building the requirements. 2021, we translate those requirements into technical infrastructure. And then in 2022, we drive the adoption of that technical infrastructure across the EU and EEA members to access 1 million genomes. The overall objective is to drive towards the European health data space. So this 3-year project called B1MG, along with the 1+ million genomes initiative, will build maturity models, it will build the ELIXIR framework, and it will give the technical recommendations and guidelines for how we can access this volume of data transnationally. It's really important, and we're talking here at the SAPHIRE meeting, which is also a CSA. It's really important to remember that these CSAs don't have the funds and the resource for the technical and developmental work that needs to be done. So when we look at the B1MG CSA, the technical and developmental work is performed in a number of different projects, nationally funded and funded by the EC and internationally funded. And I've put some examples at the bottom here. So we have EOSC Life, Healthy Cloud, SUNICA, EJPRD. Many of you will be involved in these projects overall, but the important thing to stress is that the developmental work is done in these projects, coordinated by B1MG, and then is coordinated into meeting the aims of the roadmap to access 1 million genomes by 2022. To take one example, and I'll take ELIXIR Converge as an example of a project that's funded by the EC, we have a work package within ELIXIR Converge to develop a framework for transnational access to sensitive human data under the framework of the European Genome Phenome Archive. I won't go into that in depth here, but it's suffice to say that the work here is aligned with Working Group 5 of the 1+ million genomes initiative. So this is one example where we're building a technical demonstrator to access data internationally funded from an EC project aligned closely with the aims of Working Group 5 of the 1+ million genomes initiative. So to summarise this part here, the 1 million genomes initiative drives the federated sensitive human data framework from the EU and EEA member states. The Beyond 1 million genomes CSA is aligned very, very closely with the 1+ million genomes initiative and is funded by the EC to implement the roadmap. But the technical and policy developments that are resourced and needed for this 1+ million genome roadmap come from many projects, many EC projects and many nationally funded projects. And the federated EGA framework is what we are promoting from ELIXIR to enable sensitive human data archival at the national and regional levels connected to the pan-European framework. So in the last couple of minutes of this presentation, I'd like to give an example. And where I'll focus on is ELIXIR Norway. So ELIXIR Norway has 5 regions overall, 4 health regions. And if we look at the structure of the ELIXIR Norway infrastructure, then the objective is to have a national node for the European Genome Phenome Archive with a national database here. But it's connected to 4 of the Norwegian regions represented by these nodes at the bottom. There's 5 different institutes, I understand, but 2 of these are in Oslo. So these represent 4 of the Norwegian regions. So this is ELIXIR infrastructure allowing us to access data that's in regions and regionalized across Norway, shared with a central European node into the pan-European framework using the ELIXIR AAI, which is another technology. But essentially what we're building is a framework which is technology independent that can allow data to flow from regions through countries and into the pan-European framework. So that's a bit of a whistle-stop tour through what we're offering from ELIXIR and what ELIXIR can offer to countries and what ELIXIR can offer to regions. And with that, I'll stop and I'll take any questions. Thank you.
Thanks a lot, Gary, for this interesting presentation. So we have 5 minutes for questions. So we are wondering, so you gave the example of Norway for the role of regions in this initiative. Can you think it's possible to reuse that example for the other regions?
Yes, absolutely. So in the Nordics, this is the model that's used in Norway, Finland, Sweden, but it's not the only model that could be adopted. So Germany has a slightly different model, Spain has a slightly different model, as do other countries that we're seeing within the EGA. What we're trying to build within the B1MG project for capacity building are best case examples, or key examples that can be used. And I present Norway here mostly for time constraints. I thought when you asked about how we're working with regions, I quite like the Norwegian example where they've worked with their local ministry to gain funds for a countrywide archive, but then they've connected that countrywide archive to 4 of the 5 main regions. There are 4 health regions within Norway. Each of the 4 health regions are represented in that framework. So it does work in other examples. So I could present, as I say, a very similar thing from different countries. But it doesn't work everywhere. So if you take countries such as maybe Romania would be a good one. They set up the regional perspective first, and then use that perhaps as a way to talk with their ministry. Say, it's working in these regions. Can we now provide something nationally? So there are different models that can be allowed to, for countries and regions to join this framework of the federated EGA. But the example I use of ELIXIR Norway is one that I thought would be representative for the Nordics and one that would be useful for this presentation.
And so what's your tips or your recommendations then for the regions or the regional authorities to make it happen?
It's not easy. So, and what we are actually doing in the B1MG project right now is building a map of each of the signatories for the 1+ million genomes roadmap to say where are the connections from the regions to their national infrastructure, and then where are the connections to the 1+ million genomes mirror groups. So I haven't gone into the 1+ million genomes in a lot of depth here, but there are 13 working groups. The objective is to set up mirror groups in each of the signatory countries, and then those mirror groups work within their national infrastructure to set up what they need to access 1 million genomes pan-European scale by 2022. What I can say is that the structure of these working groups and the structure of setting these up is very different in different examples. So what we're doing right now is presenting and what we have generated from the Beyond 1 Million Genomes project is a fact sheet of how to best set up the mirror groups. So I would think about how does the region connect to the mirror group? How does the region connect to the mirror group and then into the 1+ million genomes? And if the maps can be built for that, and the regions are well connected in the mirror groups that they think they should be, use cases are rare diseases, cancer, common complex disease, infectious disease. Some of these may be more or less important to certain regions. If you can get the connection from your region to the right mirror group at the national level, then it feeds into the 1+ million genomes roadmap overall.
Well, thanks a lot. So I hope you also can stay if we have some more questions, either in the chat, either on the Discord channel. So we can just continue this afterwards. So thanks a lot.